What is a cervical cap? If you're curious about different methods of birth control and have heard of the cervical cap, you're in the right place. Let's break down what it is and how it works. A cervical cap is a small, dome-shaped device made of soft silicone. It's designed to fit snugly over the cervix, which is the part of the uterus that opens into the vagina. This cap acts as a physical barrier to prevent sperm from entering the uterus and fertilizing an egg. Imagine a small cup that you insert into your vagina before having sex. This cup has a wide brim and a dome or bowl in the center, and it often has a strap to make it easier to remove. The cap is filled with spermicide, a substance that immobilizes and kills sperm, adding an extra layer of protection. To use a cervical cap, you need to insert it several hours before having sex. It can stay in place for up to 48 hours, but you must leave it in for at least 6 hours after sex to ensure the spermicide has enough time to work. Each time you have sex while the cap is in place, you should check its position and add more spermicide. There are 3 sizes available for cervical caps: 22, 26, and 30, and the right size is determined by your obstetric history. A healthcare provider will fit you for the cap and teach you how to insert and remove it properly. Using a cervical cap is relatively straightforward, but it does require some care. After each use, you need to wash the cap with mild soap and water, rinse it, and air dry it before storing it in its case. Avoid using baby powder, oil-based lubricants, or other vaginal creams that could damage the cap. While the cervical cap is effective, it's not perfect. Over the course of a year, about 14 out of 100 typical couples who use the cervical cap will experience an accidental pregnancy. For women who have had a baby, the cap is less effective, with about 29 out of 100 couples experiencing an accidental pregnancy. It's also important to note that the cervical cap does not protect against sexually transmitted diseases, STDs. If you're concerned about STDs, you should use condoms in addition to the cervical cap. The cost of a cervical cap can range from $0 to about $275, including the office visit to get fitted. Many health insurance plans cover these costs, and family planning clinics may charge less. The cap needs to be replaced every year. Overall, the cervical cap is a non-hormonal, reusable, and relatively cost-effective method of birth control that can be a good option for those who want to avoid hormonal methods and prefer on-demand use. However, it's crucial to follow the guidelines carefully to ensure it works effectively.